Okay, great. So, good afternoon, wonderful audience, and welcome to yet another empowering edition of the Vibe Live, a Hexalogue. The Vibe that stands for Women Inspire, Build, and Enhance is a platform dedicated to fostering women's excellence. It brings together women doctors from diverse specialties to share knowledge, leadership experiences, and personal journeys that inspire growth and collaboration. There are four fundamental pillars that form the vibe: the physical well being, mental health, financial wisdom, and professional excellence. Through conferences, forums, and mentorship initiatives, the vibe strives to build a strong community of women professionals who uplift one another and redefine the landscape of healthcare leadership. I'm Dr. Ritu Johari, consultant diabetologist and metabolic expert practicing in western suburbs of Mumbai. I have a unique diverse background with decade and a half spent in pharma industry and last half a decade practicing treating diabetes, thyroid and obesity. Besides clinical practice, I also contribute to research and medical writing as a co-founder of RFEC, a medical marketing agency. But what brings me the most pleasure in sharing with all of you is the introduction of this exclusive initiative, The Vibe, as a founder of one of its kind platform that targets improving fostering women excellence. I'm indeed blessed to be complemented by my husband, who's an orthopedic surgeon, and our family feels complete with a teen son and a toddler daughter. With that, happy to introduce you to our team vibe. And first of all, a very warm welcome to our guest speaker, empowering and empowered Dr. Nandini Rastogi.
Thank you.
Dr. Lotika, over to you for your introduction.
Yeah, thank you, Ritu. So I'm Dr. Lotika Purohit, a diabetologist and lifestyle medicine physician practicing in Colaba since the last 3 decades or so. It brings us a lot of joy in the middle of the week, in the middle of the afternoon, to sit and chat with and understand and get inspired by a star speaker who is also a great achiever. I'm also a visiting faculty at the JJ Group of Hospital and the Grand Government Medical College and the Police Hospital also. Besides that, I wear a couple of other hats, like I'm a Rotarian, past president of my club, and I love traveling. I enjoy visiting new, diverse locations. Now I hand over to Dr. Kavita Rane for her introduction.
Hi, namaskar everyone. Good afternoon, ma'am. I'm Dr. Kavita Rane. I practice in Chembur at Mumbai at Rani Hospital and Apollo Spectra Hospital. I practice mainly diabetes and obesity for the past 15 plus years. I have been focusing on educating my community for non-communicable diseases, and I love to interact with women more so I'm focusing more on women and children now. The main reason why I did diabetes was one of my family members suffered because of diabetes, and I don't wish for my father to do that, so I studied diabetes. Apart from diabetes and education, I love arts. I love painting, drawing. I love sketching. I love to play golf. I have had an exhibition at Jahangir Art Gallery. It was my travel photography. I have sold 13 prints in that exhibition. And I love to travel with my dad and my family, and I love this Wednesday Vibe Live. Every Wednesday, I'm looking forward to speaking to such star speakers such as you and my girlfriend. So over to Dr. Pranjali.
Thank you so much, Kavita. Good afternoon, ma'am. I'm Dr. Pranjali Shah, Director and Chief Diabetologist and Director of Internal Operations, and I heal an app diabetes clinic. It's in Mulund, Mumbai. I love treating young diabetics and to help them live longer and stronger, but I also believe in prevention. So we do a lot of community awareness camp, and we have screened more than 30,000 people in central Mumbai. But apart from my clinical work, if you don't find me in my clinic, you will see me hiking, playing badminton, doing farming on weekends, taking care of pets in the shelters along with my boys. So those are my recreational activities, and definitely every Wednesdays we love to communicate leaders like you, ma'am. Thank you so much for coming, and over to you, Dr. Rukiya.
Hello, ma'am. Good afternoon and welcome here. I am Dr. Rukiya Surya Shaikh. I am a diabetes, thyroid, and an obesity specialist. I practice in Mulund, very close to Pranjali, for a decade and a half now. And this journey has taught me that healthcare is not just about treating numbers, it's all about understanding people. When I'm not in clinic, you'll find me that I'm doing my workouts. I love to play carom, and what brings me most joy is this great company and these meaningful conversations that we have over here that make you think, that make you laugh. Also, lately I have started painting, my way of adding little color and calm to the chaos of the daily life. I'm truly excited to be here today with all of you, and ma'am especially, for being so inspiring to learn, to share, and to grow together. Thank you very much, ma'am. Over to you, Dr. Ritu, for the introduction of ma'am.
Thank you so much, girls. It's truly, like I said, ma'am, that it is indeed a privilege, first of all, to welcome you and to speak about you. And I would like to give a little bit of a prenup, like about this, that some journeys in medicine, which are always looked upon as, oh, what are the degrees and what kind of positions that person is holding. But there are a few which really touch human lives and the ones which actually shape careers for students and become really inspirational stories for people like us. And I think your story is one such story that we really wanted to bring up for our audience, which actually begins with discipline and courage. Right from the days that ma'am has been in Army Medical Corps, she's served with distinction and has been honored with the Seva Sena Medal. And then she's gone ahead and not only looked upon treating disease, but transforming healthcare completely. As a physician and diabetologist, she's witnessed firsthand the growing burden of the chronic disease in our country, but has chosen to go beyond the clinic, stepping into leadership roles that have been able to influence practice, influence policy, and also people to shape the healthcare even better. From leading the Indian Medical Association in Kanpur to contributing actively to national and international platforms like RSSDI and beyond, her voice has not only shaped conversations that matter, but a recipient of the Nari Shakti Award, she represents not just achievement, but possibility, resilience, grit for every woman doctor who aspires to lead, to influence, and to create a lasting impact. So today, to explore her journey, we've chosen the topic as the leader within, from clinical excellence to influential impact. And you are not just going to be listening to a speaker, but being experiencing a journey of purpose and leadership. This vibe Hexalogue with Dr. Nandini Rastogi. I welcome you all. And
Thank,
ma'am,
thank
a very, very warm welcome and a quick question to you. How did you feel when you were invited over the vibe?
yes. So, should I speak?
Good thoughts. Yes, ma'am.
So, thank you. This afternoon, I'm really honored, really delighted by being present for WIBE with all you trailblazers. I find your work so motivated because once I got the invite, then I went to the YouTube and I checked on some of your videos. So, you're doing such excellent work, empowering the women doctors from becoming true healers. They are always those. But now, motivating them to become leaders in their own capacity. So congratulations, keep it up, keep going. Thank you for having me.
Thank you, ma'am, for your kind words. And with that, may I pass the data to Dr. Lotika for her first segment.
Yeah. So thank you, Dr. Ritu. So welcome, Dr. Nandini. And so we'll start with the first segment, the foundation, the pursuit of excellence. So the academic excellence in your undergraduation, being selected as the best army officer in the Army Corps or bagging the Seva Sena medal, you have always pursued excellence. And so this segment is about setting the credibility and grounding the journey. You are a great leader, and that begins as a strong clinician. So, what did clinical excellence mean to you early in your career? And was there a defining patient or a moment that shaped your approach to medicine?
So earlier in my career, clinical excellence was not just about knowledge, it was actually about responsibility. It meant listening before speaking, observing before assuming, and treating the patient and not just the disease. Also, I
True.
understood that the patients don't come with textbooks. They come with their fears, they come with their uncertainties, they come with their trust. And that trust
Mm.
is actually very sacred. So that shifted my approach from being technically correct to being holistic, right? Because at the end of
Mm-hmm.
the day, medicine is not science. It is a
True.
service with human touch. सो डिग्री से
True.
डॉक्टर लोग बनते हैं लेकिन सोच से एक्सलेंस आती है दैट इज व्हाट
True.
आई बिलीव
Very true. Very, very true. Yeah. That is so right. Because these days, the art of medicine as we know it has slowly been deteriorating, and most people just see it as a science and expect, all sorts of answers. But yeah,
and the
when a patient comes to us,
connect is missing.
yeah, that's true. So, how did your experience as an Army Medical Corps officer shape your personality and your professional values?
So my tenure as a short service officer, 5 years in the Army Medical Corps, was really transformational. It gave me courage,
Okay.
it gave me clarity, and it gave me character. So
Okay.
when I was posted back in 1980s, I got a field posting in Jammu and Kashmir to a place called Aknoor. It's part of a very
Okay.
remote kind of a area, sensitive area. We are within 35 kilometers of the Pakistan artillery range, so we are very much
Okay.
there. And then at
Okay.
that time, only lady medical officers were posted. There were no medical female
Okay.
nursing staff, no other staff. So I was the only
Oh.
lady in that whole of 10 days. And I
Oh.
would be sitting in a MI room, young doctor, when suddenly a Gorkha soldier would come and say, Jai Hind, ma'am. So because he was so loud, I said, Kya hua? So he said, Madam, saap ne kata. Now, Aknoor is, warm climate. So there are a lot
Yeah.
of vipers there. So I said,
Oh.
what's a saap? And he would bring out a jar with a dead snake and bang it on my table. So these were
Oh.
my first experiences. Also, when you saw, a 300 soldiers in a 3 tonner and that fell into a ravine and we
Oh.
had a lot of injuries. So at that
Oh.
time, even Jammu MH did not have a neurosurgeon, and I had to transport these injured soldiers and officers to Udhampur Military Hospital. And that time there were open helicopters. So much of noise, my mind blowing, with the wind. It used to be mind blowing. But it taught me few things, being in the army, that discipline in thought and action, decisive,
Mm.
especially under pressure. So,
Mm-hmm.
in these resource limited conditions, you have to understand that perfection is not needed. What is needed is objectivity. Also, it made me very much emotionally stronger. And
Mm.
today, that training in the army, whether it's a clinical decision making or leadership, it has helped me. So,
Mm.
army did not train me just to be a doctor. It shaped me into a doctor who can lead, who can decide, and serve under any circumstances. And I personally feel that each one of us should serve in
Mm.
the army to learn the discipline and decisiveness.
Oh.
I mean,
Well, that's very
it's
nice.
an
Yeah.
experience
No,
which is,
it's quite, I'm sure it must be quite unnerving to see somebody bringing a snake, and even though it's
yeah,
dead, but
very you know,
it's quite scary thing. And then, of course, accidents like that's
yeah.
very traumatic also. So, looking back, what was the milestone in your journey that has been most meaningful to you? Any person or situation that you could pinpoint which inspired you, influenced you into making who you are today?
So I think the most influential person was my father. He always
Okay.
wanted me to become a doctor. So when I
Mm.
passed out in 75, did my 11th CBSE board with all my distinctions, that was the year Delhi unit in Stephens was taking women For the first time, Steve was taking women, and there
Okay.
was a lot of glamour to it. So I went on the notice board. My name was on top of that economic honors, and I was kind of thought I will take it. But then at the back of my mind, I thought my father wants me. So instead of that, I joined pre-med at Miranda House, and then
Okay.
ARC, and then rest is history. So
Oh, good.
I think one is to see that there's not a single milestone, but it is probably the lives that you impact over time, consistently over time, with your
Mm-hmm.
patients, with your mentors. Patients
Mm.
teach you resilience, mentors who teach you integrity, and your own challenges. Because the
Oh,
part
yes.
of India that I practice, North India and Kanpur, if you're a lady doctor, you're assumed to be a gynecologist. And it took me 10
Oh,
years to
yeah.
city,
Yeah.
my colleagues, and the society that I'm a physician and a good one at that. Because when I opened my first clinic, I would get a single patient and she would also complain of bleeding PV. I would come back and howl on my husband's shoulder and say, अब क्या करूं? So he said, तुम एक काम करो, तुम ये कहना शुरू करो कि मेरे पास तो gloves ही नहीं है. So, that's how the journey began. But I must say that once I had established myself, my male colleagues gave me all the respect, gave me all the accolades, but it was tough. So there have been moments of doubt, but I think they define me more than the success, because whenever there was a doubt, it forced me to ask, why did I choose this profession? And every time
Mm.
the answer brought me back to purpose. So that I believe has shaped me. And it's not about one milestone. I think it is consistency over time.
Oh, that's wonderful. That's so nice to, because I know consistency is very important, and it must have been a big challenge because like everybody assumes that any woman doctor is a gynecologist, and she'll immediately address whatever issues the
In our
women
part of
have.
North India, and then you start
Ah,
doing PVs, then you start doing MTPs, then you start doing cesareans.
oh
And I
yes,
know
yeah.
so many
Hmm.
medicines are actually now full-fledged gynecologists practicing as that, running their nursing homes, and
Hmm.
that's it. I know
Yeah,
it's
that's
big,
true.
but whatever. That's their.
Yeah, that's true. So, thank you so much. That was a nice segment. Now I hand over to Dr. Ritu Johari for her segment, for the second segment.
Thank you so much. And ma'am, I still can visualize the text they got onto your table, the way that must have happened. But yeah, those are such beautiful stories. And with that, beautifully, we shift into the segment called the paradigm shift from a dedicated doctor to a trailblazing leader. Ma'am, for ages, it's understood that doctors' cost is equal to treating patients, is equal to spending time in their own cabins, most of the time. And almost 4.5 decades ago, since now, you chose not only the responsibility to treat patients, but also adopt positions and also shape the medical healthcare system, which I'm sure being a woman wouldn't have been easy. Like you said, that even when male counterparts were there, but there were certain expectations that happened from the society that give you that flavor that you take time to ground your foot. And then you empowered more and more doctors to treat patients better while keeping your practice still at the core as a physician, a dedicated physician at that, as you rightly said. So, what was the turning point when you realized, ma'am, that you were meant more for leadership beyond clinical practice? Did this happen by chance, choice, or calling?
So I think leadership for me was a calling that I initially responded as a choice. As physicians, busy physicians, we don't really go to the IMA programs. But I happened to walk into one of the AGMs in October of 22. And
Okay.
there was massive fight going on. Actually, our IMA building was being made from 2013. and they could not complete it by 2022 because of lack of funds. So
Okay.
that was the fight about. So I reached there and said, "क्यों लड़ रहे हैं ये लोग? This is building नहीं बन रही है." तो I said, "बना दो ना." And that is how I went into the IMA president election. Fortunately or unfortunately, I won. We collected about 6 crores. We could
Wow.
complete the auditorium, the lift, the pre-conference area, and everything. In fact, I fought the second year election because some work was still left. And at the end of it, I was so sad. It was so satisfying. They gave me the best president from the national headquarters amongst 1800 odd IMA branches. So that was a different high. But that
So
is the
good.
time when I started that, my tagline became काम करेंगे, IMA का नाम करेंगे, just like a neta.
Oh,
you know? But
क्या बात है.
so leadership was not planned, it evolved. But
Understood, ma'am.
once I stepped into it, I embraced it with great intent. So if I reflect today, it began as a choice, but over time it became sustained because it was truly a calling. And I enjoyed every moment of it. So, as you said, clinical practice treats individual patients, but leadership has the power to heal systems. So that is how
Absolutely.
went on to leadership. Otherwise, all of us, we have such restricted activities. 9 to 5, we are just watching
Absolutely,
patients,
ma'am.
doing indoors. It is tough life. But when you get out in the world, and you know what, God has given you so much, there is something that you need to give back to society.
Yes.
And this is the
Absolutely.
time to do it.
Absolutely, ma'am. So beautifully you put that together, but that you feel that you're doing enough, but then at the end of the day, when you're sitting in your clinic, it's like the horse having your pads on versus when you actually see the whole world and you realize you're making much more a bigger impact and a bigger difference than what you could, and that's what you were actually born for. So that is an amazing answer that you just brought up, and I'm so happy to be hearing this.
Except for that AGM.
So my next question, ma'am. While you continue to practice, and of course you also lead several associations actively, all this can become truly overwhelming. Also, given the background that you're a woman, a mother, a wife, blah blah blah, daughter-in-law, not even getting into the multiple associations relations that we are in. So this overwhelming picture is very much there. What were the biggest mindset shifts that you think you had to make when you had to move from a practitioner, a clinician, to a leader?
So I think the shift from a clinician to the leader is not doing something more, it's doing a little differently. Everything that you do differently. I think there were a couple of changes in the mindset when you become a leader, which is from I treat, we can transform. It is
Mm,
also from perfection in individuals to progress at large, and from control. You think, as a single practitioner, you're doing everything. So from
right.
that control, you move on to collaboration. Also, as clinicians, we are trained to be precise and independent, but leadership teaches you to do teamwork, to delegate and
Right.
build others. So I realize that the impact multiplies many times when you create more leaders, not just
So true.
deliver some outcomes that you have. So today, as I reflect on this journey, I realize that success is not about how many patients we treated, but how many people you went along with, you took along with you. The teamwork came because IMA taught me the importance of teamwork. We
Mm,
women are very good at multitasking. All of you are
yes.
doing it as I hear. But when it comes to some major work, there requires a teamwork, and that
Yes.
was truly rewarding.
Lovely, lovely, ma'am. And I think that is something that we should all take inspiration from. That, it's sometimes I always see many women struggling with this, that whatever comes across, they want to do it all by themselves. So, yes, there is a need for certain things to be done, but delegation and supervision can help you do much more than what you can try to do it as an individual contributor. So, it makes more sense in you trying to lead if you are absolutely having that kind of a capability. Beautiful. My last question, ma'am. As a recipient of the Nari Shakti Award and a woman leading from the front, do you also feel that women doctors today still hesitate to claim leadership spaces? And what, as per you, holds them back the most? If you could give any one line advice to them.
So when I see the women sitting in front of me right now, I don't think they hesitate. But yes, women do hesitate, not due to lack of capability, but because of the conditioning and the self
Hmm.
doubt. I think what holds them back is waiting to be perfectly ready. जब सब ठीक हो जाएगा तब शुरू करें.
Hmm.
Understanding
Barabar.
their own voice, and also the balancing the guilt between those multitasking between professional and personal role. So I
Abs-
remember I started the clinic 5 years after my children started going to playgroup, and I have never regretted it because I don't think I've lagged behind my male counterparts. But when you start, then you should be thorough in it, you should be consistent. So, leadership does not wait for perfection, it responds to courage. So, my one line would be परमिशन का वेट मत करिए, आगे आइए, अपनी जगह खुद बनाइए. दैट इज मोस्ट इम्पोर्टेंट.
मुझे सच में रोंगटे खड़े हुए बिकॉज यस आई थिंक लॉट ऑफ टाइम्स यही होता है कि हमें लगता है यार हमें चांस नहीं मिला you know people we hear them saying that you know what I would have also done it, nobody asked me, if somebody told me I would have done it. But I think it's about, you know, if you want something you just need to go and get there. It's like the crying child is going to cry and then only he or she's going to get milk. It's the same way for you. If you want something you need to ask for it and fetch it rather than just waiting for it. So lovely, ma'am. Lovely answers. Thank you so much. With that, we'll continue and I move on to the segment. Request Dr. Rukiya to take up the next one.
Ma'am, it's been so wonderful to hear from you. And, few things which I am already imbibing from, what you have been saying is the clinician to leader is totally a mindset shift, from I treat to we can transform. I think that is so beautiful. Absolutely. And frankly, ma'am, if you would have seen each one of us a year ago, we didn't have vibe in place. And we were all completely, just talking about it that, we should have something for the women. We should have more women present on the dais and, at more leadership roles. And like you said, don't wait for the permission, just get up and be there. So this is how, with this idea, we just thought that let's get our table for ourselves and, let's just start over there. And, and we are beautifully seeing this change and the support that we are getting from each one in the community. It's been so wonderful and it's really, really satisfying. So, ma'am, my segment today is about the womenhood, diabetes, and public health. So, despite your busy schedules, you find time for public health service, which is the free educational lectures that you give, the mega health camps you conduct. So, balancing this personal, professional, and social activities makes you an absolute juggler in real life. So, now let's explore this through a gender lens, through a women's lens with her personal challenges. So, ma'am, as a woman in medicine and leadership, what were these invisible challenges did you face? Did you ever experience self doubt or guilt while balancing these multiple roles?
So, yes, like most women, I have experienced the invisible challenges that we have not even spoken about openly. I told you it took me 10 years to tell Kanpur city that I am a physician. So, that itself was a challenge. Thankfully, I was getting my bread and butter from my husband, so I was not in a hurry, but otherwise, I would have starved. So, the biggest challenges was number one, the expectation to excel everywhere. Second was, the constant balancing act between family, ambition, profession, making money, making, titles, whatever. And also that silent guilt that all women have when you're not able to give 100% to every role simultaneously. I remember my children when they had to go into from preschool to class 1. I really worked very hard. Literally उनको इतना रगड़ा दिया because I said लोग कहेंगे कि working mother है और capitation दे रही है. You know, that was at the back of my mind. So it was all there, but self doubt always creeps in. But from there, over time, I shifted my mindset. And that shifting was that you can't do everything perfectly. So, doing what truly matters meaningfully is also important. And balance is not about equal time, it is about right priorities at the right time. So
Wow,
you
ma'am.
have to kind of juggle everything. We do multitasking, but even then, when my son was getting married, I withdrew. I didn't go for conferences. You know, all kind. When my daughter was getting married or having a kid, I kind of withdrew from that. Whatever. You can't leave your clinic because that's your bread and butter. But from other things, you withdraw because you have that much energy. So you have to balance, take what is the priority at that particular time and try to do that to the best. So women don't need to do it all, but we need to do what matters without guilt. Without
Yes,
guilt.
right,
That is
ma'am.
important.
It's just this mindset that, you don't have to be perfect at every role
Yeah.
and, at all the times. The
Yes.
thing that you have it in hand, just
Then
do
you
it.
will burn yourself. That
Yes,
and you see many people burning themselves. So that's
right.
not what we need. God has given us life to be happy and to heal others. So we need to be good to ourselves also. That's
So
important.
true, ma'am.
Yeah.
Absolutely. Yes, yes.
Yes.
So, ma'am, while diabetes is just one lifestyle disorder, why is it taking this center stage in most of the discussions today?
So diabetes, as we know, it's a center stage because one, it is our bread and butter. Number one.
Okay. Huh.
Second, it is a silent killer. It damages your kidneys, your heart, your nerves, your arteries, and it is a major cause of morbidity and mortality through cardiovascular diseases. And most importantly, it is deeply linked to lifestyle and environment. So we are called as the diabetic capital of the world, not because of numbers, but because of the early onset and rapid progression. And it is important that we realize that it is largely preventable and manageable, but still we ignore it till the complications creep in. So, if we control diabetes, we control a large part of our disease burden, we improve our healthcare outcomes, and that's why it is center stage. See the sheer numbers. Mind
Yeah.
boggling. Whatever drug comes, it sells in India because of sheer numbers,
And
however expensive.
yes, ma'am. Matlab, in spite of, having more number of drugs, having understanding diabetes now much better than we had 20 years ago, the knowledge about diabetes and the pathogenesis, and now having even multiple drugs, still the incidence keeps rising. And, we are not able to get above, ahead of the incidence so that we are able to halt it. So definitely it's the lifestyle which needs to be emphasized and brought in the change. Ma'am, you know that India is a very large population and we have a lot of disparity in the medical access between an urban and rural part. So, Kanpur or Mumbai, 20 kilometers outside Mumbai is an absolutely different setup than Mumbai is. So, ma'am, what strategy, because you've been in amazing leadership roles also, what strategies do you think will help our country to improve the clinical outcomes?
I think to improve the clinical outcomes, we need to shift our mindset from being treatment centric to prevention centric. And
Yes.
multiple strategies can be done, like improving the primary care, strengthening that. So you empower your frontline doctors and health workers by training and tools so that they can diagnose and continue the care. You make the patient education and awareness an important part, because an informed patient always does better than a treated patient. And also, you must remember that many of these diseases are preventable. And lastly, I think use of technology, the telemedicine, the digital monitoring, all this can help especially in the rural areas. So healthcare should become more accessible, more acceptable, and more available to general public, to the large section of society. It is something like the CCBDM. The PHFI has started this course, and I've been doing it for the last 11 years. So we train about 30 medicos all over the UP, rural areas mostly, who come and do these 12 modules. And by the end of the year, they are practicing diabetologists. And when I was going canvassing for my IMA election, I was happy to see that some people had written after their MBBS MD the degree of CCEBDM, which is actually not. So you are empowering your juniors with education, because finally that is what is important. The number of diabetes or non-communicable diseases in our country are so large that a few diabetologists or endocrinologists cannot handle it. So it is important that everybody gets the basic quality care instead of a few getting the best care.
Right. So well put, ma'am. It is extremely important that everyone deserves a great first line care. So that should be a non-compromisable, and that should be our aim when we are nurturing the new generation of doctors. Ma'am, it's been so wonderful to hear your ideas about different things, and we'll come back to all of this again later. But right now, it's time for Pranjali's segment. Over to you.
I
Yes,
think
ma'am, you're saying.
ही important that सिर्फ मरीज को ठीक करना जरूरी नहीं है, सिस्टम को भी हील करना जरूरी है, and that is how we are going to do it.
Yes, I think yes, that is right. I think we are still, I would say, maybe I'm still self-centered. I'm still not thinking about changing the systems. I'm still trying to find the best for myself in that system. But this opens the door for these kinds of, approaches, that this is also extremely important.
Yes.
Thank you, ma'am. Thank you for being here. Over to you, Pranjali, for your segment.
Thank you so much, Rukiya. And Rukiya, I'm sure you will get those answers from being self-centered to open to the community in the next segment. The next segment is about name and fame, building influence and impact. So, ma'am, as you said, कि permission का wait मत करिए, आगे आइए, अपनी जगह बनाइए, and you have done that. So, in this segment, we'll be talking about the same, and you will be guiding us about अपनी जगह कैसे बनानी है, ma'am. So, ma'am, when we talk about name and fame in medicine, we often get associated, with the titles, positions, and recognitions. But in reality, true influence goes far beyond designations. It reflects the life we touch, like you have done a lot, ma'am, the systems we improve, and the legacy we quietly build over the time, ma'am. So, ma'am, we know that you have multiple prestigious positions throughout your journey. But, ma'am, how does one build real influence, not just the titles?
So I think we should not limit ourselves to titles, roles, expectation, because influence is not a designation. It is a reflection of your consistency in life.
Yeah.
You are in a position if you have a title, but influence comes from your credibility at work, your integrity in your actions, and genuine intent to serve. So, real influences come from credibility and contributions. So, over the years, I have focused myself upon showing up consistently. No matter the cook was there, the maid was there, but I would show up. So, that is important, whether in clinic or conference or community work, because that's what builds lasting impact and it gives you the trust of others. So, as for motivation, I think it just evolves over time, because earlier the motivation was to achieve excellence. But today it is about creating relevance and leaving a meaningful legacy. I mean, at my stage in my career, that is all that I want. So, whether what keeps me most active and motivated is the realization that there is more to contribute and more people to support and more to learn. So that is how we are proceeding with life as of now. I know all of you are younger, so you have lots more to do, but this is how, at some time, as I said, there comes a time when you need to give back to society. And this is where at present I am.
Yes, ma'am. But ma'am, I think when we are doing so much, and especially like you've achieved so much in your life, but to keep the consistency going, uh, what to do? Like we start something in our life, we decide to start something, but to keep it going, what is your secret mantra behind this?
I think it is the consistency, because that gives you the impact. The
Yeah,
titles give you visibility, but values give you influence. So you have to be consistent, because we women sometimes, because of our domestic circumstances, even a 9 to 2 job becomes difficult, if you don't have
yeah.
support at home. And that is why somehow we are not able to excel. So, no, that's why I said I started my clinic 5 years later than my male counterparts. But I have never regretted it, because once I was there, yes, clinic is a bondage. You have to be there, whatever be it, with your paracetamols, with your headache pills, or whatever. So that consistency has to be there,
Yes.
because
Yes.
that is finally going to give you the trust of your patients also, and
Yeah.
society also.
Yes, ma'am. And ma'am, now we know that you're part of very national and international bodies like IMA, RSSDI, ADA. So, ma'am, what do you feel the role of networking in our life? Do you feel like we have a lot of new, early in their career doctors? So, how should they approach networking meaningfully in the conferences?
So, networking, of course, plays a very transformational role, especially early in life,
Yeah.
because associations like your IMA, RSSDI, the American Diabetes Associations are not just platforms. They are actually ecosystems of learning, of collaboration, and growth. So you can stay updated with evolving science, you can exchange views with your peers and your younger colleagues, and most importantly, it can broaden your horizon. So, networking, when done right, I feel, is not about collecting contacts or names, or you scratch my back, I scratch your back. It's about building meaningful collaborations. So, it is important, networking is important for personal growth, but for collective progress, it is required.
Absolutely, ma'am. I think the team, as you said, team building is really important. And then rather than doing alone, if we have a team, we can achieve much more than achieving single person. And
So,
Rukia, the next, yeah, yes, ma'am.
actually not just expanding your reach, it expands your thinking. So,
Thinking,
that
yes.
is what networking should be all about.
Yes, ma'am. And my next question, ma'am, it's about most of the doctors, they begin with a focus on individual success, like we focus on clinical skills, patient outcome, personal growth. But over a period of time, the question evolves. How do we scale our efforts from one patient at a time to influencing population practices and policies? And how can we go ahead in this?
So, I think transition from individual success to community impact, you have a simple shift from what am I achieving to what am I enabling. That becomes very important. So, if you want to do impactful leadership, you must mentor the next generation. That is very important. And also, you have to take healthcare beyond the hospitals to the community. So, a doctor's role today is not just limited to prescribing treatment. We are also educators, we are advocates, and we are change makers. That's how we should be looked at. So, when your work continues to create impact, even in your absence, that is what you want. So, impact is collective, and that is the true meaning of leadership. This is what I feel.
Yes, ma'am. And one question, ma'am, is like I just want to have your personal feedback about when we want to start, supposed to connect with the community, especially we were planning to go in the rural areas and start our outreach programs. So do you have any one tip where how can we start the step we want to take? And so we want to have your tips.
So I think that if you want to take up a rural area, you should adopt one particular rural area. You know, when we hold medical camps, we don't see those patients again. And it is quite useless because you've given some tests, you've given some medicine, but there is no follow up. So
Yes.
when you're going to the rural area, do the basics. Give minimal medicine, do hemoglobin, do the basic investigation, and give treatment to the majority of them. So the majority is getting good basic quality care, and then keep going to them, because that is what is going to get the rewards.
Yes.
Hopping from one area to the other, like we do in our medical camps, that doesn't work. You need to adopt a rural area, a village, a whatever, through various means, which is possible. The RSSSDI is also doing it. So
Yes.
I think it is very important, because prevention starts from home and not in the
Yes.
hospitals. So
Yes.
probably adopting an area and going back to that area, I'm sure you will be able to improve the healthcare system within 6 months to 1 year if the follow up is there.
Yes, very true, ma'am. So because if we adopt one area so that we can have regular follow-ups and we'll also come to know how many
And they
prevention is
also
there.
know where they can get in touch with you, where you have, when they have a medical problem or whatever.
Yes, ma'am. So thank you so much, ma'am, for your inputs.
Thank you.
And over to you, Dr. Kavita, for the next segment.
Thanks, Dr. Pranjali. Good afternoon, ma'am. It has been so inspiring and enriching to learn from you up until now. So, there are a few audience questions for you. So, our next segment is called Audience Ask. And so, uh, sorry. So, the first question is, in today's fast evolving medical world, how can young doctors avoid becoming average practitioners?
So, in today's rapidly evolving world, staying average is actually a choice. Okay? Maybe a happy choice also. But
Yeah.
to stand out, the young doctors must focus on three things. Number one, continued learning. Never stop being a student. That's very
Yeah.
important. Second, they must have a clinical curiosity. Don't just treat, observe, understand why, communicate. And lastly, we are becoming into a corporate culture. Never forget the compassionate care that we need to give, because finally, patients remember how you made them feel. So, excellence is not an event, it is a habit that you have to practice day in and day out. Without that, it is not successful.
Very
So,
true.
my tagline for this would be that average doctors, they just follow protocols, but excellent doctors, they question, they learn, and they treat, and they evolve.
Amazing. Perfect, ma'am. That is so true. So our next question for you is, if you could give just one health mantra for every family watching today, what would it be?
I would say respect your lifestyle before the disease forces you to respect it. And
Hmm.
prevention, as I said earlier, starts at home and not in hospitals.
Yeah.
So, simple habits can improve your lifestyle: eating mindfully, staying physically active, managing your stress, sleeping adequately. Because prevention is the most powerful prescription, I feel. And as I said, we should move away from being treatment centric to prevention centric.
Right. That's amazing, ma'am. Just one more question. How do you personally stay clinically updated despite such vast leadership responsibilities?
It's tough. We all know it's tough. But I follow a very simple principle that learning is not negotiable. So, no matter what, one tries to keep up with the guidelines, with the journals, with the conferences, interacting with the peers. So, and especially as a leader, it increases your responsibility to stay updated because so many people are looking up to you. So, I believe in learning, unlearning, and relearning because that keeps me relevant. Because the
That is,
doctor stops learning,
yeah.
then stops becoming a leader also. So you need
Very
to.
true. Very true, ma'am. Especially the unlearning part, that is so important. You can't be God. You can't even behave or get close to that. If you have that attitude, nothing changes. So, all right, time to switch gears. Let's lighten it up with our next segment, which is called the Pulse of Life. So it's a rapid fire round, and I have a few questions for you. So, are you ready, ma'am?
Yes, I am. I am.
So, yeah. So, one word for your journey as a leader, as IMA president.
Transformative.
A strength most women doctors underestimate in themselves.
Their resilience.
Clinical excellence or public health impact. Which matters more today?
Both. But if clinical excellence is the foundation, the public health impact is the multiplier.
Perfect, absolutely. One habit that changed your life.
I have two. One is
Tell us.
lifelong learning, and the other is consistency. Showing up every day, no matter what. Whether the maid came, the cook came, I would be there. So that helped.
Consistency. Yeah, true, true. So, a leader you deeply admire, ma'am.
President Kalam, for his
Yeah,
humility and vision,
yes, totally. For his vision. Yeah. One myth about success you want to bust.
that success is a destination. It is actually a journey, a lifelong journey.
All right. Tea or coffee during long OPD hours.
Decaffeinated black coffee if I have the time.
Okay, nice. One stereotype about women doctors that you strongly want to break.
I have two again. That we have to choose between family and career. We can lead
Hmm.
in. And
Yeah.
second, that leadership and empathy cannot be present in the same woman. It can.
Wow. All right. One message for white women doctors in one line.
Role model sitting in front of me, but trust your journey and never underestimate your influence. Because as doctors, you're trained to save lives, but as leaders, we are responsible for shaping the future of healthcare.
Yes. Perfect. So lead from the front.
Yes, always.
One last question. Fill in the blank. Okay. So a woman doctor becomes unstoppable when
She
dash.
stopped doubting herself, stopped seeking permission, and believing in her purpose.
That was sharp, sincere, and so authentic. Just what WIBE stands for, ma'am. Thank you so much. It was amazing.
This,
Over to
this is,
Dr.
yes.
Ritu. Yeah. Over to Dr. Ritu.
Lotika for the closing.
Dr. Lotika.
Oh, Dr. Nandini, this was really fantastic. Just had so much fun and so much of learning from all your all your teachings and your one-line quotes and things. I think we will all remember a lot of things from that. So, courage, clarity, and character, discipline through tough times, and those are some of the things. And I'm sure um, you said Saint Stephen's would have been
Very
your
glamorous. I
would
would
have been
refuse
very
that.
glamorous, but I'm so glad that you decided to be a doctor, and I'm sure you've created much more impact with that. So I ask Dr. Ritu for her learnings.
I think, I have so much to say. And so to start with, I'm glad that ma'am brought the glamour here. Forget the glamour at St. Stephen's, but she brought in glamour here. And she also is enabling the ones with glamour to understand of how they can make an impact. Because I guess nothing more bigger than what you can give back to the society, ma'am. I'm so happy that, that is what White believes in, and that's what you also brought out. So we are so happy to get the validation that we are doing exactly what, should be done, that we're giving back to the society. We really want to have people get influenced. And even 1% of women who listen to these stories get to what they want to do, get to live their dream. I think that is what is success for us as well.
So
So
I
trust
will
me,
just
yes.
add a little bit to the glamour. When we joined the Short Service Commission, all of us were
Uh-huh.
wearing those OG
Uh-huh.
cotton sarees starched to the brim. So we said,
Yes.
day in and day out, you're wearing this OG olive green color. How do we get
Uh,
glamour? So me and couple of my classmates from FMC Pune, we got white silk and we got it dyed into olive green, and we started
oh.
wearing those sarees just to have a change, because day in and day out you were wearing the starched cotton olive greens and you wanted some glamour. So
So, ma'am, I think clearly you have been a trendsetter, and that again is showing up, in your work as well. So, totally kudos to you. And on a personal note, ma'am, I think, yes, I do agree that while we're all very smart and empowered, but then at the same time, we have a mindset block at times, when we are mothering our children, or, and having children, and children never grow. I mean, mothers are always going to have children who are small, so I personally take that line really true, that showing up every day is very important. Because yes, cooks do not come, maids do not come, it doesn't impact the males of the family. It always does impact the women of the family. And in one of the episodes, we were just talking about the fact that, when we're outside, even when we're traveling outstation, still, if there's something which is not there at home, or something is not working at home, it's the woman who gets the call. But that's what makes us more resilient, because we are multitaskers, and we should just reinforce ourselves, reclaim ourselves. And I'm so glad to have all these women with us, and you, of course, motivating us to stay right up there and say that no, we will still show up.
right, great.
And
So for
Rukiya?
me, yeah, so
Okay,
I will
Pranjali.
start and then Rukiya can take. So
Okay.
for me, I think each and every statement what ma'am was saying is it was a learning for me. And the way she's talking and sitting and smiling, it was really nice to see you, ma'am, and it is lovely listening to you. But the main thing which I recollect and will remember always is listening before speaking is the thing when you see your patients, and observing before you assume. So that is the thing which we should practice when we are treating our patients. And obviously, परमिशन का वेट मत करिए, आगे आइए, अपनी जगह बनाइए. So
Yes.
thank you so much, ma'am. Rukiya.
Ma'am, you have sent such amazing one-liners, but I think for me, what Dr. Nandini Rastogi is, where there is a will, there is a way.
Yep.
If she wants to do it, she'll find the way for it and she will lead it from the front. So that's really kudos to you, ma'am, for that. What I realized is you don't have to be perfect at all the time. Being holistic is more important than being technically correct. And leadership has the power to heal systems. So I think, yes, that is something which I will take from today's episode, because we think of leadership as a very different in a very different point of view. So this has been a big eye opener to see how you can actually chain systems if you are into this, right? So, ma'am, wonderful. Otherwise, we just sit outside and we are cribbing
Also
about it.
add one more thing. परफेक्ट होने का वेट मत करिए, स्टार्ट कीजिए, परफेक्शन आ जाएगा.
हाँ.
That's how you started
Well,
why 6 months
Yes,
back.
ma'am. Absolutely.
Gradually begin. Action is important.
Action is important. Taking action is important, right, Pranjali?
That's,
I forgot
Kavita,
what
over to
to
I
you.
think Kavita.
It is true, ma'am, because at the beginning we never knew how is this going to happen, how is WIBE going to happen, how are we going to get so many people and gather them, and how female doctors are so busy on Sundays, and how we had all these thoughts and ideas, and we were like, no, you got to do this. So we led from the front, all of us. We're like pushing each other. Yes, you got it, you got it. So what we learned from you today was exactly this, ma'am. Leadership from the front, and be confident in yourself. And what you talked about, the it being treatment, from treatment centric to prevention centric, is what we need to focus on, towards community education, towards health, and towards enabling the next gen. That is so important. What we learned, if we can pass on and forward to them, they are going to share that with everyone else, whether in a medical profession or not. But still, they're going to be empowered by what we know. And the other thing that I loved what you mentioned was values create impact. So that is exactly where it starts, your values. If you don't have an empathy value, you're not going to go anywhere. You're going to get stuck. So thank you so much, ma'am, for today. And it was really inspiring. Thank you. Over to Dr. Ritu.
So thank you so much. It was really so nice to have you, Dr. Nandini. And
Loved being here.
pardon?
Said I loved being here.
Thank you so much. So we end with our signature vibe. You put both your hands together to form a W, and we say at the count of 3, be the vibe. So 1, 2, 3,
Be the vibe.
Be the
Bye.
Thank you, ma'am. Thank you so
Loved it,
much.
ma'am.
Thank you so much.
So much fun.
Thank
I
you so
hope you
much,
had
ma'am.
fun too.
I had fun, and I'm going to watch it on YouTube. And I see
Yeah.
what I said.
Absolutely.
You
It's
were
always
Yeah,
fun.
it looks so
You
nice on a big
amazing,
screen. You can
Yeah, true,
watch
true.
it, fortunately, these days.